An elderly woman who contracted Legionnaires disease has died as Victorian authorities work to determine the source of the outbreak. For more, reporter Steph Ferrier joins me now from Melbourne. Hi there, Steph. What's the latest update that you have?
Yes, good afternoon. Just recently we have heard from Dr Claire Looker, who is Victoria's Chief Health Officer. She has said that this lady was among 60 confirmed cases and 10 suspected cases in this Legionnaires disease outbreak. And she's also given information that 59 of those 60 cases have been hospitalised, many of whom have been also put into intensive care, suffering from severe community-acquired pneumonia. But this is what she had to say about our first fatality in this case.
Very sadly, one person, a lady in her 90s, has died after contracting Legionnaires disease. This woman became ill on Tuesday evening, presented to hospital and passed away shortly after, and our condolences are with her family.
That's Dr Claire Looker there, the Chief Health Officer of Victoria, and she's also given us an update on just where the investigation is at. Now, what she has said is that they are now focusing on an area in Melbourne, which is Derrimut and Laverton North, and so they are predominantly industrial areas where we have a lot of those cooling towers, and at the moment they are using mapping software to be able to cross-check where a lot of these people who have tested positive have been moving around, and then looking at some of those crossovers as well. So they believe that they have already identified about 100 towers, which are the most likely causes. So far, they've already gone along and tested and looked at about 41 of them and also disinfected them. They're also looking at another 15 towers today. But this is what she had to say about the situation in terms of those cooling towers.
I think there's a high probability that we have already visited the tower and disinfected it, and that is really driven by some pretty compelling epidemiology and crossover of where many of our cases have visited. I'm cautious, I obviously can't say that with certainty until we have test results back, but yes, confident that it is one of the ones we've visited.
So as she says there are a lot of cooling towers that they are currently looking at, and the difficulty is that they obviously take a little bit of time for those test results to come back, because it really depends on the level of the Legionella bacterium that might be there, that needs to be first of all colonised and then come up with enough of a sample to create a positive test result. So far they have received no positives at the moment, but it is a really wide geographical spread as well. And so what they're believing is that it could be due to Melbourne's very cold weather and what's called a thermal inversion. So they've actually been working with the Bureau of Meteorology to try to work out why we've seen such a widespread area, even if some of these cases or the cases can actually be pinpointed to this particular Derrimut and Laverton North area. It's obviously spread through fine water droplets. There was also a question as to whether or not a recent fire, a factory fire in Derrimut, might have caused a bit of a problem. She says that at the moment they believe that it's unlikely that that could have caused any implications in terms of creating the Legionella bacterium, because there hasn't been any sort of documented case either here or internationally to suggest that fire could have such an impact.